Hi, Joe Johnson here, going to be going over the appendicular skeletal system. We'll start with the pectoral girdle, which has your clavicle and your scapula. Your clavicle does have your sternal end, which has the sternoclavicular joint, and your acromion end, which has the acromion-clavicular joint. Your scapula has your coracoid process, as well as the flat surface on the dorsal part of the scapula is your subscapular fossa. On the ventral aspect, you have your spine that goes into your acromion, as well as above the spine is your supraspinosa fossa, and below the spine is your infraspinosa fossa. Your humerus has your humeral head, which is the ball that fits into the shoulder joint, as well as your greater and lesser tubercle. Your deltoid tuberosity. Going down a little further, you have your medial epicondyle, as well as your coracoid fossa that houses your coracoid process of the ulna when you flex your elbow. You also have your capitulum, which articulates with the radius, and your trochlea that articulates with the ulna. On the back side, you have your olecranon fossa that houses the olecranon process of the ulna when you extend your elbow. For the ulna, we do have the coracoid process, the olecranon process, as well as the styloid of the ulna. For the radius, we have the radial head, the radial tuberosity, and the styloid of the radius. Going to some of the carpals. We'll start with the more proximal row. You have your scaphoid. You have your scaphoid, your lunate, your triquetrum, and your pisiform. The scaphoid, lunate, and triquetrum make up your wrist. The pisiform does not. And then on the more distal row, you have your trapezium, which articulates with your pollex. You have your trapezoid, your capitate, and your lunate. Those all articulate with your metacarpals, and then after the metacarpals, you have your phalanges. Next, we'll go into the pelvic girdle. The pelvic girdle is comprised of your sacrum, your coccyx, as well as your coxal bone. We'll talk a little bit more about your coxal bone, which has 3 fused bones. Your ilium being about the upper 2/3 of it. It goes into about the middle of the acetabulum. And then on the inside here, goes until right about down here. That upper part is your ilium. And then if you split it kinda in superior and inferior regions, the top part will be your pubis and the bottom part will be your ischium. So bottom part ischium, your top part will be your pubis. So we do have your acetabulum, which is the cavity for the femoral head to form your hip joint. You have your pubis symphysis, which is the cartilage that connects the left and right pubis. Also on here you can see I have the pubis marked out, and then the ischium below that. You have your arbitrator, the coil in the middle. You have your anterior superior iliac spine, your iliac crest on the top here, and your iliac fossa. On the back side you have your greater sciatic notch, your ischial spine, and then your ischial tuberosity. For the femur, you have the femoral head, just the ball that goes into the neck. You have your greater and lesser trochanter. Next you have your abductor, which is slightly superior to your medial epicondyle. And then you have your lateral epicondyle. On the back side you have your medial and lateral condyles. And then you have your patella here on the front. For the tibia, you have your medial and lateral condyles, as well as your tibial tuberosity and your medial malleolus. For the fibula, you have the fibula head, as well as the lateral malleolus, and then your distal and proximal tibular fibular joint. For the tarsus, we'll go into some foot bones. We have your calcaneus, which forms the heel. The talus, which actually articulates with your fibula and your tibula on the top side here. So your talus. You have your cubicoid, which articulates with your calcaneus, and your navicular, which articulates with your talus. You also have your lateral, medial, lateral, intermediate, and medial cuneiforms. That was backwards, sorry. Your lateral, intermediate, and medial cuneiforms, and the medial cuneiform articulates with the hallux, your toe. You have your metatarsals and your phalanges. Last we'll talk about the hip and shoulder joint. They are both ball and socket joints. So the ball, or the head, fits into the cavity of the socket. It provides movement in multiple directions, making them flexible. However, the hip joint has a lot of muscles and ligaments, and it sits pretty deep in that socket. So it is not the most flexible joint, but it is great for support. And the shoulder joint fits a lot more shallow and doesn't have quite as many ligaments, so it is a lot more flexible and a lot more movable. That concludes my video. Thank you very much. Couple clarifications on things. You do have your glenoid cavity up here, and I think that the proximal tibiofibular joint didn't quite make it on there, as well as your distal tibiofibular joint and your lateral and medial malleolus.